Hi, everybody, and welcome to the Kylee Cast. I'm Kylee Griswold, managing editor at The Federalist. Please like and subscribe wherever you get your podcasts so you never miss an episode. Leave us a 5-star review. It's one of the easiest and best ways you can help out the show. And even better yet, if you're just listening to the show, go check out the full video version on my personal YouTube channel or The Federalist channel on Rumble. And then, of course, like and subscribe there too. If you'd like to email the show, you can do so at radio@thefederalist.com. I would love to hear from you. Today, I'm pleased to welcome to the show Devon Kurtz. He's the Director of Public Safety Policy at the Cicero Institute, where he works specifically on the issue of homelessness. And today, I get to talk to Devon about a new bill in Louisiana that is being decried by its critics as, surprise, surprise, the new Jim Crow. It's one of the left's favorite smears for policies they don't like. Today, Devon and I dive into the specifics of the bill, why it's absolutely not the new Jim Crow, and we also talk about how we can address the issue of homelessness across the country more broadly. So without further ado, please welcome to the show, Devon Kurtz. Devon Kurtz, thanks so much for joining me today on the Kylee Cast.
Thank you so much for having me.
Yes, it's such a pleasure. I knew I wanted to invite you on the show as soon as I read the piece that you had in the Federalist, which we will get to in just a minute. But first, for our listeners who maybe aren't familiar with you, can you just start us off by telling us who you are, where you're from, and how you got into the work that you're doing now?
Happily. So I am the policy director focusing on public safety at the Cicero Institute, which is a think tank in Austin, Texas. I've been with Cicero since it started. It actually started in San Francisco, has some Silicon Valley roots, and our experiences there largely shaped my current work on homelessness. We're national in scope now. We work in more than 30 states, advising state lawmakers, advising federal agencies, the White House, uh, and I live in Salt Lake City.
Okay, excellent. So I first came across your work because of this article that you wrote for the Federalist that's specifically about a bill that is arising in Louisiana. And specifically, what you wrote about is that the critics of this bill are calling it the new Jim Crow. They're calling it any number of names, actually, but Jim Crow seems to be their favorite preferred smear right now for policies they don't like. And so I'd love if you could just tell listeners well, more broadly, how else are critics framing this bill, and then contrast that with what is actually in the bill? What would it actually do?
Yeah, I've been at this for quite a while now, and I'm used to smears. I will say that Jim Crow is a new one. We've gotten
For this
detention
topic? Yeah.
camps, concentration camps. We've gotten all sorts of horrible things. Those were largely in reference to trying to create areas where people could camp safely, where there would be services and bathrooms and law enforcement and basic order. But those were maligned quite similarly as detention camps.
Mhm.
So Jim Crow is a new one, and it comes in response to a bill that has two components. One is that it regulates street sleeping and camping.
Okay.
What that looks like is essentially the same penalty for littering. We can think of littering and unregulated camping to be comparable offenses. They often involve a stuff that's being items, tents, sleeping bags, burners, trash.
Mhm.
Oftentimes, we see encampments swell with litter.
Mhm.
I mean, there's cases in Austin of encampments being cleared with 600 tons of debris removed. So these big encampments really can create a lot of physical waste and contaminants. A
Right.
lot of this is quite toxic to waterways. You could think about someone not being able to use a bathroom and actually using the bathroom out in a park. That can have impacts on the soil, on waterways, etc.
Mhm.
So it has a very similar impetus of why would we want to regulate street camping for a
Mhm.
very similar reason why we regulate anytime someone is bringing um, excess stuff and leaving it in a public space.
Right.
So the penalties are roughly the same. There is more discretion on camping to impose other types of penalties beyond just a fine. But this other component is really where this Jim Crow malignment comes from, and that's it creates also a diversionary program. So whether someone is cited or has some other greater violation imposed through camping, or for other crimes associated with a homeless offender, so a homeless person committing the crimes, doesn't have to be just camping. It could be a variety of misdemeanors and even some low-level felonies. Uh, they can, instead of being brought to jail or convicted, they can have access to a treatment court. So a
Hmm.
judge can impose a sentence of treatment in lieu of the criminal justice penalty. And as part of that, they can be asked to complete community service. And that has been compared to forced labor. And that's where we get the Jim Crow label. So, community service, something that is often also associated with littering or minor
Right.
offenses, could be as simple as cleaning up the area that you have destroyed in your encampment, or volunteering at a shelter that you're now staying in. Any of those things are being considered forced hard labor by critics of the Louisiana bill.
Okay, there's so many directions I could go with this. For the first thing that I was thinking, just as you're talking about, the litter in these parks or whatever, because yes, there are so many contaminants, just all of the garbage and everything that accumulates. Um, it's really not fair to citizens of these communities that pay their tax dollars to have access to clean parks and clean benches, and like these are things that they pay to be able to use. And I would imagine that these types of things also invite other crime, even if not by homeless people. You think of just the broken windows theory of policing, where if
Absolutely.
things are left to deteriorate, if you don't fix the small stuff, then bigger stuff, it invites bigger crime. And so I would imagine that that's part of it. So the critics, I mean, is part of their issue the fact that this is a law enforcement thing, like that the police are the ones dealing with this? Like, of course a judge can say, this person needs to get mental health treatment or whatever, but are they complaining about the over policing element of it?
It is, and it's a flashpoint of a broader ideological debate. I'd say it's several ideologies or strains of ideology coming together.
Hmm.
So you have, I would say, the homeless activists themselves tend to be people who are steeped in homelessness policy. The main divide would be people who view homelessness as purely an economic issue,
Mm.
that irrespective of any other issues a homeless person might be struggling with, the fact is they are principally defined by their homelessness. And all homeless people share this one aspect, thus they can all be addressed through fixing that one aspect. And I would say that that differs from my perspective, which is that actually there's many different subpopulations of the homeless. They're all homeless for different reasons, and
Hmm.
if we want to properly get them out of homelessness, as well as not just being a disordered person inside, or a criminal inside, or a drug addict inside, or mentally ill inside, but actually trying to address these underlying issues, we have to first identify what those issues are, and then create interventions that meet them where they're at, and understand that some people, principally those who are severely mentally ill, those in the criminal justice system, and those who are severely addicted to drugs, probably aren't going to have the urgency to help themselves because of either in a disordered state of mind, or an addiction. So we have
Hmm.
to intervene differently. But that's one flashpoint of the debate. You then do get the individuals who I'd say are more focused on things like prison abolition, police abolition, the kind of usual radical takes on the criminal justice system. And this has sort of created an unholy alliance between the two, where
Mm.
they can attack it both for simply by the involvement of the criminal justice system, saying, oh, this is bad, but then also because they're framing the issue as one strictly of poverty, it seems misplaced.
Hmm.
Now, what we often cite is, take Louisiana. 18% of the people living on the street are convicted sex offenders.
Mm.
We're not criminalizing those individuals. They are already criminals. They have been
Hmm.
convicted of some of the most serious crimes and are now living on the street.
Hmm.
If we were to broaden that out to felonies, I don't have precise data for Louisiana, but we can look at Utah, where I live, and where we've worked a lot on some policies that were also maligned, similarly to the one in Louisiana, but that one was labeled a campus that was going to offer behavioral health treatment was labeled a concentration camp in the New York Times last fall. over in Utah, again, similar debate played out. Over 3/4 of the 1,000 most arrested individuals in the state of Utah are homeless. That accounts
Hmm.
for roughly half of the unsheltered population. So, and then again, another third are convicted sex offenders there who are living on the street. So, and those, some of those may also be in that most arrested category, but given the severity of their offenses, if they had been arrested again, they probably would have been moved from the street. So we can speculate that that's actually maybe a separate population. So at this point, what's the remainder of the unsheltered population that's not either chronically being arrested or a convicted sex offender is actually quite low.
Hmm.
And so this argument that we're criminalizing it, or that we shouldn't regulate these spaces, that there is no crime around homeless encampments, it's really, it doesn't bear out in the data.
Hmm. Hmm. And if I'm not mistaken, a lot of the outcry over the complex in Utah was because of the civil commitment aspect of it, where,
That's right.
yeah, people with uh, severe mental illness would be committed, regardless of their willingness to participate in that. Um, So break this down. You mentioned the percentage of sex offenders that is in this category, but for people who like don't live in the data like you do, if poverty is not the main driver of these things, you mentioned poverty, severe mental illness, addiction, and crime as like these main things. So if you're looking
That's
at a
right.
bar graph of like how does this break down? Is it pretty evenly
Sure.
divided, or is there too much overlap in the reasons why people are homeless that you can't even really break it down? Or like, is it fairly even across the board?
Yes. So there is no one driver, and part
Mhm,
of this is because we think of homelessness again as that binary of are you homeless or are you not?
mhm,
But there's actually a more important question. Are you a homeless person who is staying in a shelter and is actively engaged with services continually,
mhm,
or are you not? That binary is far more important, because of the people who seek out shelter, comply with the rules of the shelter, engage with a case manager, and uh, maybe receive some public support, maybe they don't, they resolve their homelessness in about 45 days on
mm,
average. It's rare for that group to remain homeless. We would describe as chronically homeless, someone
mhm,
who's having many episodes of it, and having them quite frequent. So those individuals, many of them self-resolve, which meaning they exit homelessness actually without government support. And then some number of them also are exiting with some kind of subsidized housing. And there's a couple ways that can come into play. Some of that, if they're they could get a transitional housing unit, which would have a bit more programmatic structure. They could get rapid rehousing, which is just a housing voucher for 1 to 3 years that they can then use to get back on their feet and stabilize. And then for those that have more severe disabilities, there's what's called permanent supportive housing, which is a longer term program to keep them permanently housed.
mhm,
What we've seen in Louisiana is that actually the homelessness has gone down over the last 10 years. And this is despite Louisiana has not been spared the increases in housing costs. People who often say this is a poverty or a housing crisis issue will point to rising housing costs and say that's what's causing homelessness. But actually, what we see, homelessness has gone down in Louisiana. There was about
mm,
5,200 people who were homeless in 2013. And in 2024, the latest data we have from HUD, that was about 3,400.
okay.
What hasn't changed is there were 1,500 people living on the street then, and there are 1,550 people living on the street now.
Mm,
So the proportion who are living on the street has actually increased overall, but the number has remained relatively stagnant.
mhm,
And those individuals who are in the shelter system are resolving. They're exiting homelessness. That part of the system is working as it should.
mhm,
The part that's failing, despite massive increases from the federal government into different housing interventions, are the people who are living on the street. That's where you get that very disordered population that is often a combination of mental illness, criminal justice involvement, both seriously and with kind of chronic misdemeanor offenses. Someone might never go on to commit very serious crimes, but they're committing dozens of petty thefts or car break-ins or things like that.
mhm,
Um, and then you have the addiction issue that's quite pervasive. I would say there's a remaining category of people who don't fall neatly in those other buckets, who have either broken a lot of the rules in shelters,
Hmm.
or are temperamentally quite difficult uh, socially, whether that's with
Okay.
their family, with service providers, with shelters. And their issue is not necessarily one of say, schizophrenia or meth addiction or crime, but they are still very hard to case manage because of some other non-serious mental illness, but probably personality disorder.
Hmm. Hmm. So, in light of these statistics, the Louisiana bill makes perfect sense. That seems like the right approach to take because you're not talking about homeless people broadly. You're talking about camping specifically. You're talking about unsheltered homeless people.
That's
Um,
exactly right.
so, my question is, what do the critics who are calling this Jim Crow, the people who are against reforms like this, what do they propose instead? Like it just the status quo? Do they
Yeah,
deny that
it's a
there's a
one size
problem?
fits all. Yeah, yeah. They say it's a one size fits all. That I mean, you get a range of calls. The
Hmm.
most famous book I would say on the subject right now is Greg Colburn's "Homelessness is a Housing Problem," and he
Ah, yes,
essentially
the housing
argues
first
for
approach. Yes.
exactly.
Yes.
And I mean, he goes even further than I mean, he does give a plug for housing first, but he goes even further and essentially argues that we should decommodify housing. That the principal problem is that housing is an asset, and that is what that capitalism is sort of at the root of this. And his solution is if you can systemically bring down housing costs, and he often proposes structural interventions that would be government subsidized housing, which is the core of housing first. Uh, I would say that they're generally agnostic on other ways that the markets could bring down housing, like we've seen in Austin, like we've seen in Salt Lake, where simply building market rate housing has actually decreased housing costs. Unsurprisingly, we have not seen commensurate decreases in the number of people living on the street
Mhm.
when we just bring down housing costs. That
Right.
does affect the number of people flowing into the shelter system. That does affect other pieces. But these are individuals who exist largely outside of that system,
Mhm.
which to your point is why it's so important to have that regulation of camping as a way of moving people into services. And then, the court system that is being designed in Louisiana within the same bill is to make sure that when that sweep happens, that they are being moved into a system that can care for those underlying needs. So that's a very different model than one that is solely looking at structural housing trends
Mhm.
and seeing that only long term subsidized housing is the only solution. And the other piece of this is, and I'm not against some form of subsidized housing for many of these individuals who need it. What I am against is having no conditions for it.
Mhm.
When you're asking someone, if you think of two people, you have one man who's living in an encampment, and it does skew male. That's one of the other major divides, is that
Mm.
it's usually over 2/3 to 3/4 male living on the street.
Okay.
Women tend to be in the shelter system, especially women without any kind of drug addiction. They're going to end up in the shelter system. So if you think of two people, one is a meth addict, which until the Trump administration changed this, that qualified as a disability that could earn you permanent housing under HUD policy. Uh, and then you imagine a woman who maybe has a kid and has some sort of physical disability. She would also be then eligible for this what's called permanent supportive housing.
Mhm.
But because of the way that permanent supportive housing is structured, they could actually live next door to each other.
Mm.
And also until last summer, with the president's executive order under HUD policy, that meth addicted man could be a sex offender and could still be housed next to that family.
Right. Right.
So you need to have much more intention about how we're structuring existing housing programs. Again, I'm not against having a housing program, but it needs to have expectations of conduct. It needs to have expectations for treatment, and where possible, move people to some level of independence.
Mhm. Yeah, not to get too philosophical, but what are the incentives for the housing first approach? I mean, is it mostly just more money? Is it about dollars? Is it about getting more tax dollars for these programs? Is it about undermining capitalism? Like why if these
Yeah,
approaches are not working or they're not addressing the problem of camping, which is just appears to be the most persistent problem, then what are the incentives for people to continue to pursue these policies? Is it
sure.
mostly dollars?
I think I I mean, my organization has been a harsh critic of a lot of these organizations, and we've worked with several states on audits of the homelessness systems, and we do see some sketchy things. A
Mhm.
colleague of mine, Paul Webster, sued the city and county of Los Angeles, over their homelessness policies. I mean, they lost $1 billion. I mean, they couldn't account for any of the uses of those funds. I mean, there
Wow.
was some really serious misconduct in
Mhm.
Los Angeles, um,
That's
and
shocking.
he's helped expose that. In some of these smaller states, there's not as many zeros, but we've still
Right.
seen in Arizona instances of some of these nonprofits using public funds to give personal loans to their executives. We're doing some research now on executive pay for some of these NGOs, and seeing how that compares to their overall proportion of funding, and how in many communities this issue is getting worse. But I think that at a service provider level, the individual who's running one of these housing programs, part of the challenge is that oftentimes they're a separate organization from a shelter. They can be the same, but let's say they're a different organization. Their case managers are going out to the shelter, which again, as I said, skews different in terms of gender, skews very different in terms of level of disability, in terms of criminal background, et cetera. So they're dealing with really the easiest cases of homelessness, because they're going to the shelter, and they're getting them into housing, and those people are generally succeeding.
Mm.
We do see some level of failure. We also see some level of what I would describe as sort of an overprescription, in that when we're giving someone permanent housing, and by permanent, it's not just that they have a lease and an address. That is a big piece of it, but it's also that the subsidy might never end. And when we're giving someone that should be a pretty high bar. If you're
Mhm.
going to keep someone on government dependence indefinitely,
Mhm.
that should be a pretty high bar. And we
Mhm.
don't always see that in the homelessness organization. So they're giving that to individuals that may not fully require it, and they may not be pushing them once they're a tenant to move on out of that at an adequate pace. So
Mhm.
there are challenges there.
Mhm.
But we then think about they're missing many of the hardest cases. That meth addicted sex offender who's living under the bridge, they're not interacting with as many of them or as frequently with them because they're harder cases to reach. They may not be under the bridge tomorrow. And
Mhm.
outreach workers are the connective tissue, as well as law enforcement, between the services system and those individuals they have to go out and find.
Mhm.
So their vision of homelessness is very different. And their vision of the success of their system is very different. They think that if only everyone could get because they see homelessness as a monolith, as solely an issue of poverty,
Mhm.
if they could only get the man under the bridge the same intervention they're getting the woman in the shelter, they see that as an equivalent need and an
Mhm.
equivalent success from their intervention. But the activists know better.
Mhm.
And the activists are the loudest voices. They're the ones who are calling this Jim Crow. It's not usually the service providers. Not every service provider loves the reforms that we work on, but they generally are more amenable. The
Mhm.
activists are a different group, and this is much more ideological.
Mhm.
This is more of a critique of capitalism. This is more of a belief that only government subsidies can solve these things.
Mhm.
That the government could abolish poverty. That poverty is a choice,
Mhm.
and usually in a distrust of the criminal justice system.
Right.
That
Right.
if these individuals are criminals, they're criminals because they're poor, because we've criminalized poverty, and we have criminalized all of their traumas, rather than some sort of vague social services intervention that, by the way, the data does not show are particularly effective. But
Mhm.
that's sort of this idealism around what the government can provide to end poverty and end crime.
Mhm. Mhm. So, what do you think the relationship between law enforcement and homeless people should be? Like, the law enforcement aspect is difficult because, as you say, there are so many different reasons why people are homeless. Somebody who is
Yeah,
primarily a criminal who is homeless is going to have different considerations than someone who is, or is suffering from a schizophrenic breakdown versus somebody who
absolutely.
has a severe substance abuse problem. So, I mean, you know, how should these things work together? I tend to think that I don't know how it can be not a law enforcement problem. Um, and yet at the same time, it's such a multifaceted issue that like
Yeah,
what should that relationship be?
sure. So I'll start with an acknowledgement that of homeless individuals who are uh, in shelters, law enforcement presence in a shelter keeps a shelter safe. A shelter should be a salvation. It should
Mhm.
be a place where you can go to get that stability.
Mhm.
When shelters are dangerous, which is something that we often hear of, oh, well, that person lives in the park because the shelter's dangerous.
Right.
I then ask, who made the shelter dangerous? Other homeless people.
Mhm.
That's a failure of the system.
Right.
And a failure of the system to acknowledge that some homeless people make other homeless people unsafe. So that is a law enforcement issue.
Mhm.
And this is especially true around drugs and around contraband. You'll hear a lot about low barrier shelters, about shelters that allow drug use, allow drug paraphernalia. We've done a lot of work to ban that, to create what are called drug free homeless service zones,
Mhm.
which is basically you take the drug free school zone policy and apply it to a shelter.
Mhm.
And
And
part
can
of
you
that is
explain
signaling.
why I'm sorry, can you explain
Sure.
why this is such a problem in shelters? Like, is it just that people have such severe substance abuse problems that they, like, are viewed as being unable to function without these substances, or why is that a problem?
It is again a misunderstanding of the needs of the individual.
Like,
So
if we
if you have a
help them first,
shelter,
then we can get them clean versus the other way around, or
exactly. I've
okay.
heard discussions. I won't name the state, but I've heard discussions where a shelter system had a more proactive law enforcement presence, and it became the most sought after shelter in the city, and it became the safest shelter in the city. And the conversation among some of the service providers was, well, if this is being safe because we're turning certain people away because they might cause problems, then that's actually a failure. They would rather be able to serve this population that is making it unsafe and harder to
Mm,
serve other populations because there's such a high need there. And I get that, but what we find is that when we create a safe environment, it actually allows people to move out faster. It frees up more
mm,
space. It allows the system to flow better. And it creates a very clear message to those who are living on the street that we will meet you where you're at, but you have to meet us halfway.
mhm,
You have to be willing to comply with some basic order because it's not your right to make someone else feel unsafe.
mhm,
So law enforcement has a crucial role in the shelters of peacekeeping. When it comes to encampments, it has a crucial role there as well, because just as many homeless people, there's some good data from San Diego on this, uh, showing that homeless individuals were a few dozen times as likely to be, or more likely rather, to be convicted of very serious crimes. Sorry, to be victims of very serious crimes. Several
okay.
dozen times to be victims of serious crimes, and they were several hundred times as likely to commit them.
Mm,
What that shows us in both cases, though, is that a lot of this is an overlapping population.
mhm,
That most crime is being committed by homeless people towards homeless people, and a homeless person who's committing a crime today may be a victim of a crime tomorrow. So
mhm,
there's just a ton of antagonistic activity happening in these unregulated spaces,
mhm,
and this idea that an encampment is somehow safer than a shelter is ridiculous. It is not
mhm,
borne out in the data. I've written extensively about this, and moreover, it really romanticizes the independence that's associated with living in an encampment. These individuals are not choosing to live there. Oftentimes, they have been kicked out of shelters because of their bad behavior, or they may be a convicted sex offender, or they may be out there because they are either being preyed upon by drug dealers or are dealing drugs themselves, or some combination of both.
mhm,
The sex trafficking that occurs in these encampments is quite high. As I said, most women are in shelters. If you're a woman in one of these encampments, rates of sexual violence, rates of sexual trafficking, very very high.
mhm,
Um, I won't name the state again, but there was one law enforcement officer that we worked with very closely who talked about clearing an encampment and finding a 12-year-old girl. who had run away from her parents in one of these tents. She was being trafficked, and she had been addicted to drugs at a very young age, and was living with her drug dealer, and that's an unacceptable reality. We have to do far more about that. So law enforcement must be at the table, but it's as much to save that little girl as it is to punish the one who is preying upon her.
Right. Right. Yeah, the emphasis on independence too, not to veer too philosophical again, but it's just seems to be like a misunderstanding of what independence and freedom are and what they're for as well.
Exactly.
We don't freedom is not just this libertine idea of just being able to do whatever you want, because these people are in no sense independent or free. Like, they are slaves to substances or to,
Mhm.
their decisions or whatever. That's not independence. That's a really, really uh very enslaved way of living, actually. And whether you're in a shelter or on a park bench does not dictate whether you are free or not. So, and in fact,
Absolutely.
you might have a lot more freedom by submitting yourself to somebody who's going to help you than thinking that you're freer by doing it on your own, but actually being a slave to the way that you're living. And um just kind of a different way of thinking about it. um so, switching gears just a little bit, because you brought up the Trump executive order a little while ago, and I did want to
Yes.
touch on that. I think it was over this past summer, July maybe, that was
That's right.
issued. Can you just refresh our memories for people who maybe weren't as tuned into
Yeah.
that at the time? What did the executive order include, and how is that affecting what states are doing? How does Louisiana's bill specifically um, accomplish these goals? Like what all was involved included in that
Sure.
order?
Yeah. So this is a July executive order from the White House that is a major development uh, from pretty much the Obama administration on. We saw a continuity of homelessness policies under what we described earlier as called housing first.
Hmm.
And that was a philosophy that as I said, homelessness is a housing problem, that it can be best addressed through the provision of government subsidized housing, and that housing should have as few or no strings attached as possible. There should be no expectation of any kind of compliance with services, treatment, and because the individuals are given a lease, there's actually very little that can be done to enforce certain kind of conduct. So it was a very hands off approach, and this managed to survive the first Trump administration. There was a great degree of skepticism of it, and when Secretary Carson was in charge of HUD, and they began the process of reviewing it. It's one of those things where frankly, uh, there's not a huge bench of conservative talent looking at homelessness. So
Mm,
when a Republican takes over, there was not a ready guard of individuals to start to take on this issue.
sure.
And its worst manifestations in California had only just started to be realized.
Hmm. Hmm.
So we then get to the second Trump administration, and this is a pretty early priority, in large part because so many states had been already quite active on the issue and trying to move around the federal government's restrictions under the Biden years, over trying to move away from housing first and trying to do things like Louisiana is doing in terms of regulating street camping, which under the Biden funding rules, the nonprofits who receive federal funds could actually receive bonuses in their point scores if they advocated against policies like we're seeing in Louisiana.
Hmm.
So it was actually taxpayer funded activism.
Okay.
And so there was all of these different challenges that needed to be removed. And this executive order focused primarily on the U.S. Department of Housing and Urban Development and trying to, directing them to remove these bad incentives, such as advocating against these policies, and instead creating incentives for them to promote them.
Hmm.
Then you had, as well as ending the housing first mandate, and ending this huge incentivization of housing first, and allowing states to experiment with different approaches
Hmm.
and be incentivized to do so. Then there was the Department of Justice and the Department of Health and Human Services, which were both directed to take a closer look at things like serious mental illness and addiction and civil commitment and our responses to those. Um, Looking at practices like harm reduction, which is sort of at best the distribution of naloxone, which can reverse an opioid overdose,
Hmm.
and at worst is the distribution of clean crack pipes in Kensington and Philadelphia, and this and tacit endorsement of substance abuse.
Hmm.
So they're reviewing that, and they've been very nuanced about harm reduction. They've continued. The administration has continued to support common sense things like Narcan, and roll back, as recently as 2 weeks ago, policies like or programs like fentanyl test strips, which at first sound quite good, but when you look at it, actually don't really save lives, and actually um, can create problems because some individuals will use them to find fentanyl to use,
Mm,
rather than trying to avoid it. So
sure.
some of these issues are quite nuanced, and it doesn't ban it. It just doesn't allow a small pool of federal funds to be used for it. States are still
Hmm.
free to experiment. All of the executive order applies to federal funding.
Hmm. Hmm. Okay, so let's rewind because I think, we've looked at the recent past of like the Biden era, the Obama era, the housing first. But this problem I think goes back a lot longer ago than that. Can we just talk a little bit about how we got here? And maybe like the role of deinstitutionalization in this. Do you
Sure.
think that that's overblown? Like was that not the main driver? Yeah, how did we get
Sure.
here? How did this problem get so out of
Yeah.
control?
So I've spent a lot of time thinking about institutions, psychiatric
Mhm.
institutions, and their evolution. I'm working on a piece on it right now that traces that history back to the very first one in Virginia, the very first public psychiatric hospital. And if you read the notes from the colonial governor to the House of Burgesses, you see a very similar description to what we experience today.
Mm.
That there are these individuals who are clearly unwell, who are wandering the countryside and ending up in our jails, and there's this moral outcry to do better for them,
Mhm.
and I really see that as the crux here, and this is why, to go back to Louisiana, it's why, yes, there's a criminal justice intervention, but that's really to create the lever to get someone treatment.
Mhm.
The goal is not to jail people. The goal is to get them into drug treatment and behavioral health treatment. Unfortunately, because of the process of deinstitutionalization, we have to rely on the criminal justice system because we
Mhm.
used to have a civil system that is now very, very narrow. So the main difference, if we go back 75 years to the mid-century,
Mhm.
we had a system where an individual with mental illness could be treated before they become dangerous, and before they've committed a crime,
Mhm.
and they could, a physician, um, and with oftentimes family members, could diagnose someone and see that they are deteriorating psychologically, and need some amount of involuntary treatment, largely because they're unable to recognize their illness. That's one of the main symptoms of schizophrenia,
Mhm.
is detachment from reality without realizing that detachment from reality.
Mhm.
So there was a system in which we could intervene preemptively.
Mhm.
Most people didn't stay in these institutions indefinitely. I think that's kind of a myth. There were
Okay.
definitely some who were long term patients, but there were many who were stabilized and then released.
Mhm.
When we closed a lot of these institutions, it was done in a couple of ways. There were some natural pressures, so that there was actually a change in need because of developments in science. One of the ones that we don't talk about a lot, um, is penicillin.
Mm.
Penicillin cannot cure schizophrenia, but it can cure tertiary syphilis. And syphilis used to be one of the most common and debilitating diseases. Penicillin was the first drug that could respond to its most severe form, which created neurological damage. So if you had syphilis for over a decade, you would have the symptoms of schizophrenia or dementia.
Mm.
And there was actually no earlier ways of, in about 1910, there were earlier treatments for early stages of syphilis, which prevented more people from developing into severe syphilis. But it wasn't until the late 1940s that, with wide access of penicillin, that we were able to actually treat that most severe form. This
Okay.
constituted between 10 and 20% of admissions to asylums.
Wow.
So I mean, it's a huge portion
Hmm.
that basically end of World War II, that population no longer needs to be treated there. They can be treated with antibiotics.
Right.
So then you get more treatments actually for psychiatric disorders. You get basically antipsychotic medication,
Hmm.
and that's where we start to see that some people can be treated in the community. But most of the research emerging from that time indicated that the rate of rehospitalization was quite high. So it wasn't actually uh, as there was some sort of this what I would describe as pharmaceutical optimism around, and I would even say idealism around these medications, and it we sort of jumped the gun in closing too many beds too fast and narrowing who could be treated in that environment, and really by the 1990s, we see a pretty substantial decrease in the scale at which we're
Hmm.
using these facilities. And you go back to Peter Rossi and some of the early ethnographies of homelessness in America, Skid Row, some of these great ethnographic texts. They're talking about seeing mentally ill people on the street, which is very different from what it was 25 years ago. This is a new population that's emerging onto the street. And it's not so much that all of them were in institutions,
Hmm.
it's that had we a different eligibility and capacity, they would have been in them. So it's you can see it often on social media, the map of deinstitutionalization and the rise of mass incarceration, and it is not an entirely accurate chart. In part because it's often not the same individuals. There was some turnover. The average life expectancy of people with severe mental illness is less than 60. So a lot of these individuals were different, but they would have at a different time been treated in the civil system.
Hmm.
By the time we get really to the 70s, 80s, and then especially after the Americans with Disabilities Act in the 90s, we basically have no way to treat an individual even in the civil system until they've committed a crime,
Mm.
and then it's pretty much a coin toss whether or not they're going to end up in prison or in a psychiatric hospital or both.
Right, right. So how do the shelters, like we're talking about in Louisiana, how do they compare to the institutions of the 1940s or the 19, yeah, I guess deinstitutionalization started in the 50s, correct? So prior to that,
That's right.
how do they compare?
So I think um, there are some shelters that are focused on homeless individuals with mental illness.
Hmm.
That's not the majority.
Okay.
I would say that there's a pretty substantial challenge. What we see typically is um, a disproportionate number of homeless individuals with severe mental illness live outside, and that rate has been increasing.
Hmm.
It hasn't been increasing as fast as other states in Louisiana, but here in Utah, the mentally ill, unsheltered homeless has increased by about 5x. So in the last 10 years. So we
Hmm.
see nationwide a huge growth in the both the number of mentally ill individuals who are living outside, not in shelters, uh, but also a higher proportion of mentally ill homeless people who are not in shelters.
Hmm.
And what that signals to me is that the shelter system is not equipped as it's currently, and this goes back to that low barrier approach that
Hmm.
has just as there was a low barrier approach for housing that came in tandem with a push to be low barrier in shelter. And you can think about if you're an individual with severe mental illness, you may have a hard time in an environment that's unregulated,
Hmm.
both because you may be more prone to act out and you may also be more likely to be a victim of someone else acting out. If the shelter is less
Hmm.
safe, the most likely people to be victimized are those with severe mental illness.
Right.
So it goes hand in hand that a less safe environment hurts the most vulnerable. This is a very vulnerable population, and they're largely unable to take advantage of the existing shelter system,
Hmm.
and others are able to be exiting, and this population is stubbornly not. We see that there's some interplay with addiction. I think that's another big difference between the mid-century and now, is that because people with serious mental illness are in the community in these unregulated environments, they're far more likely to be preyed upon for especially methamphetamine.
Mm.
And long-term methamphetamine usage has such deleterious effects on the brain that it actually can present as schizophrenia, and it actually can develop into schizophrenia. So that it's this really complex mess of substance abuse, victimization, severe mental illness, that frankly, if you look at any state hospital in America, the few psychiatric beds that we have left, any of those environments is going to be better staffed than a shelter or one of these housing complexes.
Hmm.
Certainly better than an encampment. Far safer, and really the only abuses that the federal watchdogs can find in these institutions is patients victimizing other patients because
Mm.
the hospital can't medicate the individuals properly because of those same federal watchdogs. The
Hmm.
civil liberties watchdogs in these hospitals will sue a hospital for having one patient attack another patient, and not adequately protecting their patients. But then they will turn around and sue them again if they try to medicate the offender so that they don't act out and abuse
Right.
other patients. So they're in a
Right.
bind. These hospitals are really in a bind under our current system. This is one of the things that the executive order directs the Department of Justice and Health and Human Services to look at,
Hmm.
because so much of um, the restriction on these state hospitals has been placed upon them by the federal government.
Hmm. Hmm. So before I let you go, I want to just touch on states for a little bit
Sure.
outside of Louisiana. Um, there was a piece this week. I forget if it was on his Substack or in the Federalist, but by Chris Bray, who is a Californian, and it was just a classic example of California disorder, especially as it relates to substance abuse and homelessness. He was in one of the um, big parks in Los Angeles. I forget the name because I'm not an Angelino, but um, basically that I think it was the mayor, Karen Bass, who posted a notice that ICE would not be tolerated in this park because this park was only going to be used for its lawful intent. And in the background behind this sign are just people passed out, completely unconscious, in pools of their own vomit and other excrement, and just, totally incapacitated. So, the implication being, yes, the lawful intent of this park is clearly for people to be camping here and to do it, being very unwell. Um, but anyway, so California is on that end of the spectrum. But then you have states like Louisiana and Utah that are making efforts to reverse some of these bad trends. I would just love to know, from your point of view, the research that you've done, what states have the best approach to the homelessness crisis, and what can other states learn from them and start to implement?
Sure. Yeah, the story from California resonates with me. Again, I lived in San Francisco in the late 20 teens, and saw really some of the wreckage of not just the federal housing first policies, but of California doubling, tripling down on bad ideas. I
Hmm.
was there under a DA that would rather prosecute cops than criminals. And I, as you said, I mean, I do think that to give a glimmer of hope in California, I've been back in San Francisco a few times under their new mayor, and I will say things are not perfect. It's still California, but they're trying.
Mm.
And I can't. This is not a problem that can be solved overnight. It's not a problem that's going to be solved as simply as passing HB 211 in Louisiana.
Hmm.
It's a stubborn issue that requires work day in and day out from service providers, from law enforcement, from policymakers who will have the backs of their residents and of the homeless people who are suffering. It is not compassionate to let someone lay in a park, strung out and delirious and throwing up. That is not good for them either.
Hmm. Hmm.
So
Again, that's
I
not what freedom
really
looks like. That's not what independence looks like. Right.
exactly, and they also you can't in good conscience wait for them to to come out of this and say, now I'm ready for help. that to me only further emphasizes that addiction is a moral failing or mental illness is a moral failing. If we're saying they have to choose to come out of it, then we're implying that they're choosing to stay in it. And I
Mm,
don't fully accept that.
mm,
So often that's why we need that push. And I think the mayor of San Francisco is trying to do that. And I have some hope there. We see Matt Mahan down in San Jose. He's running for governor in California. He's doing the same thing. So it's not a solely partisan issue. Like I'm going to now go and pivot to some red states, but there are some blue city mayors who see the writing on the wall, see
mm,
their communities dying, see their neighbors dying on the street,
mhm,
and want to do the right thing and are starting to. California has a long way to go. There's a lot of headwinds, but they're
mhm,
trying. Some of them are trying. Uh, Turning to Utah, which has been highlighted, in the New York Times several times as a national leader and as the state that rose its hand the fastest and with the most effectiveness to implement the president's executive order and have been doing really great work on it for several years. Uh, what's unique here is that we also have this, despite the polemics of the New York Times article from last fall on the homelessness campus, there actually is a lot of cooperation between the mayor of Salt Lake City, the mayor of Salt Lake County, both Democrats, and the police chief who used to lead the Department of Corrections in the Cox administration. So he's has been a Republican,
mhm,
senior Republican official. Um, and then the Cox administration itself, Representative Clancy, who was a longtime legislator working on this, is now the state's homelessness coordinator. And what you see is a very pragmatic approach.
mhm,
There was unanimity in support for camping bans, and there was again unanimity in support for not for the campus, but for building um, several smaller residential treatment sites. So there's it can be done without the controversy we see in Louisiana.
mhm,
And what it really looks like is leaders coming together and hammering out proposals that are reasonable, that have a compassionate framing, but also understand that accountability is key to showing compassion to a group of people who are a danger to themselves and their communities,
mhm,
or who are just unable to get out of this themselves and need that helping hand. So they're moving in a great direction. We don't see the same level of refusal to enforce if there's an encampment at the Jordan River Trail. The police department is dealing with that. Within this last year, there's now if an individual is arrested for breaking drug laws in a park, a judge can now order a no trespass order for them on that
mm,
park before they're even
mhm,
convicted, so that there could be a temporary period where that individual is no longer disrupting that park, so
sure.
that families can come back. And this was a big issue we saw in Salt Lake, a very family oriented community like the state of Utah, denying families access to parks because of individuals using drugs is just sort of a non-starter here.
Mhm,
So it lasted a very short period of time, and
mhm,
we do see a groundswell of support around those efforts. It's a unique place politically, but we do
mhm,
see other states following suit. I expect to see Texas be a leader on this. Florida, they've both taken action
mhm,
on similar policies to what we're seeing in Louisiana, but they're not done. They're going to keep working at it, and they have some buy-in from cities like Miami, cities like Austin, that have come around on this idea that we really do need to intervene. Miami has had historically a lot of success with the very kind of program that Louisiana is proposing.
mhm,
Judge Leifman, who has worked very closely with Salt Lake County to try to develop a diversion program for homeless individuals. If you were to look at that framework, I would argue that it is very similar
mhm,
to the Louisiana bill. It may even be um, a more aggressive form of what is going on in Louisiana. So oftentimes where the activists want to focus their attention and criticism, uh, it depends on the day. But I've been surprised to see policies that were hailed as meaningful reform in Salt Lake County and in Miami be compared to slavery and Jim Crow in Louisiana.
Mhm, mhm. We really shouldn't be surprised by any of this anymore, but, anyway, yes. Devon, this is clearly a very multifaceted issue. You're doing such great work on it. Thank you for all of your work on it. For people who wanna dive more into these numbers, learn more about this issue, where can they find more of your writing?
Yeah, definitely, check us out at the CiceroInstitute.org, our website. I write pretty regularly for City Journal over at the Manhattan Institute.
Mhm.
Um, I've been on NPR quite a bit about particularly the Utah project, but there's also a debate with me and Dennis Culhane, a professor at UPenn, who's one of the chief architects of Housing First from Philly Public Radio. So there's a lot of good content out there.
Awesome, awesome. Well, thank you so much for sharing your expertise on this with us today. Really appreciate it.
Of course. Thank you so much for having me.
Thank you so much for tuning into this week's episode of the Kylee Cast. If you haven't done so already, please like and subscribe wherever you get your podcasts. We have a channel specifically for the Kylee Cast on Spotify and Apple Podcasts. So if you are only subscribed to the Federalist Radio Hour or You're Wrong with Molly Hemingway and David Harsani, two of our other great Federalist podcasts, be sure that you're also subscribed to the Kylee Cast so you never miss an episode. And then leave us a 5-star review. It's such an easy way for you to help out the show. So what's stopping you? As always, I will be back next week with more. So until then, just remember, the truth hurts, but it won't kill you.